the symptoms that led up to it. I never saw, blood in my stool, which is a really common occurrence for colon cancer. And it was all the fatigue and the appetite and then the pain the night before. I always have an appetite. Being in the restaurant industry, people that do work in that industry know that it's long hours, you're on your feet a lot, so you're tired all the time. So I've always worked in restaurants, and early 2021 when we opened Rosen's Bagel Shop in Austin, and then we opened a second one like 5 months into it. When I started looking back, when I'm realizing what the signs and symptoms were, it was really easy for me to push them off as normal life occurrences because of what I did for a living. The weirdest one was the loss of appetite, though. We were going on kind of a cross-country trip. We went to this really nice restaurant, and they brought out the bread, and I took a bite of the bread. In like a technical perspective, I could tell it was really good. It was baked great. It's fantastic flavor. But for some reason, I just didn't want to eat it. And I've never experienced that before in my life. We ordered probably 5 or 6 dishes and everything was the same thing. I just had no desire to continue eating them, even though they were tasty. So that night we boxed up most of our food and went home. And then a few days later in Florida, the same situation happened. We went to this Cuban restaurant. It's pretty famous down there in the Tampa area. I ordered this monster Cuban sandwich, which I was really excited to try. And I probably had 3 bites of it. And I was like, I just can't eat. And it was like the weirdest feeling. I was the guy that would not only eat my entire plate normally, but I would finish Kristen's, my wife's plate as well. I love food. And so that was pretty alarming to me. And I just kind of felt generally off. It's really hard to explain, but I lacked a lot of energy. The weeks before that, I remember a couple times driving to different bagel locations of our restaurants and having to pull over in the middle of downtown Austin and just rest for 5 minutes. I set a 5-minute alarm on my phone, put it in a parking spot, and fell asleep. So that was when the signs were really something is wrong. I ended up going to a blood testing, kind of like a chain where you just walk in and walk out kind of thing, and they email you the results, and it's kind of up to you to decide what to do with those. And there were red flags on there, but most of them kind of pointed towards a pre-diabetic situation. And so I was like, okay, I'll just eat better and exercise and take care of this on my own. Still started feeling weird, went to an urgent care. He gave me kind of a quick review and saw that the inside of my ears were inflamed. And he was like, yeah, because of all the elevation gain you just had on your trip, you probably had an ear infection, you're just coming out of that. It might make you feel a little lightheaded and blah, blah, blah. And that's probably what it is. So we're going to give you some antibiotics and hoping that takes care of it. Everything from there happened really quickly. It was a couple days later, and I started having really bad back shoulder pain. It felt like I pinched a nerve or something. And I was trying to just stretch it out during the day. We had a business meeting that day. I couldn't sit down. I was standing flat against the wall while we were having this meeting. It was super awkward. And my business partner, Joe, looked at me and he was like, you need to leave. And so I went straight to a masseuse and tried to get them just to hammer whatever I thought was wrong with me out of my shoulder. And that did not work. Went home, laid on the couch, fell asleep. This is 3 or 4 in the afternoon. Woke up around 10 o'clock. My wife was trying to get me to go to bed. And I was like, no, I'm just going to sleep on the couch. I don't feel like moving. And then about 3 or 4 in the morning, I woke up with the worst pain I've ever experienced in my stomach, kind of liver area. And I couldn't move. And every breath I took was it literally felt like someone was stabbing me. And so I kind of slid off the couch and crawled to the bedroom and propped myself up on the bed. And I'm super awkward because I'm holding my breath because it hurts so bad. And so I'm grunting, making these weird noises that woke my wife up. And, she's like, what the heck is going on? What are you doing? And I was like, we need to go to the hospital right now. When we got into the ER, they did like the basic vitals and blood tests. And he was like, I'm not really sure if there's anything serious. Let's maybe put you on some pain medications and send you home and see how you feel. But before they sent me home, I said, okay, I will say I haven't been eating and I'm struggling with energy and that sort of thing. And so he was like, okay, well, then let's get you into a CT scan just to double check. The ER doctor just looked at me and he said, I have good news and I have bad news. The good news is chemotherapy is really good these days. And that's how the conversation was led off. And I was like, are you saying what I think you're saying? Like, do I have cancer? And he was like, well, I'm not technically the person that can diagnose you, but it does appear that you have cancer because your liver is completely covered in lesions. And so I didn't even know what to think. I think I asked him, like, okay, do I go home? Like, what's happening? And he was like, no, you're here for the weekend for sure. And we'll go over the next steps. So we had to get a colonoscopy the next day. So I went into the colonoscopy prep that night, and I remember coming out of the colonoscopy like very woozy. It's very bizarre because they tell you right when you're coming out of anesthesia, like what they found. And you're like still trying to just like figure out where you kind of are. But I remember him very clearly saying, we found a mass and it's confirmed that you have cancer. We need to do surgery before chemotherapy because my mass was really close to causing obstruction in my bowel pathway. So we needed to get it out of there pretty quickly. We removed the mass. They only had to take a small amount of my colon out. So I wasn't required to have a colostomy bag. From there, they said, you need to recover and then you can start chemo in 2 weeks. You have so many questions, but you're not talking to the right people yet because you don't have your oncologist. And so I'm asking, what should I be eating? Like, how should I be helping my body even now before this all starts? And I remember the surgeon looked at me and he said, brother, you've got so much cancer spread that you should just go home and have pizza and have beer because it doesn't look good. Just enjoy your life. I received a phone call from an oncologist, and over the phone, he was like, I looked at your reports and probably got about 2 years left to live. And so like all this is happening and there's like not actually anyone to have that conversation with. So you're just spiraling mentally. That was definitely the hardest few days of my life. So they originally told me I was going to be on chemo for life. It's a frustrating thing for someone with stage 4 is all you ever hear is, we're going to give you treatment to keep you alive as long as we can, but nothing we're doing is going to cure you. I had a port installed in my chest during the procedure when they removed the mass, so we were ready for chemo. We did a drug called Folfox, which is one of the most standard lines of treatment for colon cancer. The plan was to do 6 months of that in combination with a targeted therapy called panitumumab. I am somewhat fortunate that my cancer is not mutated, so I had a little bit more options and hopeful response from the chemo. So we started chemo and we got our next PET scan 3 months in, and the initial PET scan that we received was so great. Almost all the cancer was gone. Everything had shrunk by about 60%, and a lot of the lesions in my liver had started to calcify and die. So it was like this huge wave of hope that really needed. So right from the get-go, we had positive results. And then I think the next PET scan, I had no evidence of disease in anywhere, which was something that I'd never actually expected to get to. After the 12 rounds and going net, I was kind of like, okay, so can I stop? like, do I need to keep doing chemo? And they're like, no, you're in chemo for life. I'm telling you, like, it'll come back. And so we went on a maintenance chemo, which was one drug. I think we did that for a few months. And then we switched to an oral pill called Xylota, and that was a lot better, just like side effect wise and just quality of life. Then we started seeing our tumor markers in our blood tests rise again, signaling there's a recurrence coming. So once that happened, we did see in the PET scan a little spot in my liver come back. So they put me back on FOLFOX because my body had tolerated it well. It felt it was still safe. And, a month or two later, it was gone. And I went back into no evidence disease. So I started getting this like cockiness, I want to say, like, honestly, that like I can do this, and like it was helpful in a confidence way, but I think it made me kind of lose track of like how serious this is and not to take things for granted, because a year later after that, now we're in the second year, there was recurrence in my liver again, and this time also in my lymph nodes. The spots were still relatively small, so they thought that it would be fine to go off chemo for a little bit, or to take the chemo pills and use radiation to try and get rid of the lymph nodes. So we did 3 weeks of radiation, 15 treatments, zapped away the lymph nodes. But while we were on the radiation, and because we weren't on aggressive chemo anymore, the liver started spreading more and more, and then ended up getting to the point of the next PET scan that we saw progression not only in the liver, but now it spread to my lungs for the first time. And so they were like, okay, you responded well to chemo the first time, we're going to try it again. A month or so in, we realized it wasn't working, so they switched to a different drug called Fulfiri. We did that for a couple months and saw that that wasn't working, and that's kind of where we are today now. But we recently just started a clinical trial, an immunotherapy clinical trial at MD Anderson 2 weeks ago. There's been some really positive results in it in other cancers. It's the first time we're using it in colon cancer. It's an interesting mental experience. You're hopeful because you've seen positive results, but you also there's nothing to go off of for your cancer. You're just a giant leap of faith. It is a persistent struggle. Very early on, we knew that if we were going to have any chance at this, we needed to be as mentally strong as we possibly can be. The buffalo behind me and the buffalo skull are our mantra and the way we view this journey, because once we learned that buffaloes are one of the only animals that go into the storms, because if you go into the storm, it passes more quickly versus running away from it. So every time we've hit an obstacle, we've absorbed it emotionally, handled it the way we need to handle it, and then told ourselves, let's be the buffalo and let's get after it and go kick some butt. So really made the worlds of difference to me was getting out into nature and like reconnecting there and going to it even when I didn't want to go to it. The side effects from chemo are so intense that it's giving you every excuse in the world to lay in your bed and rest and feel sorry for yourself and scroll on social media and not have an active lifestyle at all. And you have every right to do that when you're going through this. You need rest. I think that's the most critical thing for recovery. But my wife has been so strong in like pulling me out of those moments, and booking trips and being like, okay, this is going to be 2 days after your chemotherapy, but we can do this. You can do this. And if you feel bad when you get there, we'll rest. You don't have to do anything you don't want to do. But when I found that I would push myself to get out there a little more and just spend time in silence in nature, I felt so strong. My wife and I love traveling. Her name's Kristen. We married in 2021 as well. And we've traveled all over the place together. We've traveled almost completely covered the United States at this point. We went to Peru, and did a bunch of hiking and sand surfing, because if you're ever going to be present somewhere, like what better place to be than when you're staring at like a beautiful landscape, or mountains that are like you can't describe or you can't paint. And so it teaches you like the appreciation of being present. It's a lonely experience, and if you allow it to be that lonely experience, my goal from the beginning has been to try and find ways to either prevent this from happening to somebody else or help somebody through it. So we first got into some volunteering. We worked with the American Cancer Society. We've helped throw an event called Fort Cancer the last 2 years that has raised money to help cover lodging and transportation costs for patients that are visiting, MD Anderson or San Antonio, and they're outside of the city. More focused on colorectal cancer is the organization Fight CRC. We were nominated to be ambassadors this year, which has been a really amazing experience.
Thank you so much for watching. If you were inspired by this story, we've queued up another one for you here. And please make sure you subscribe to the Patient Story community, where we're humanizing cancer one story at a time and always reminding people you're never alone.